Hello and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you for joining us. For Your Health is a program that, makes sure that you stay healthy. Today, as in programs past, I'm joined by the Public Nurse Coordinator here in the city of Quincy. That would be Caitlin Pico. Caitlin, welcome back.
Thank you for having me, as always.
Always a pleasure to have you. This topic, the flu, we meet once a year around this time of year to talk about it. It's something that that sees a resurgence during the fall into the winter.
Yes, definitely October through March is definitely flu season, so it's great to be prepared, and as always we love to brush up on simple things like what even symptoms to monitor for, just to make sure people are out there staying safe and taking care of themselves.
And I guess an added challenge, not only this year but for the past few years, has been COVID. Is it COVID? Is it the flu?
Yes, and that as we go through the symptoms, they are almost the same exact as COVID. So it is hard to tell. You just want to make sure you're monitoring yourself and your family for symptoms. If you do get sick, stay home. Potentially take a COVID test if you have one. It doesn't hurt, just you don't want to pass whatever that infection is that you have, you don't want to pass it on to others.
Don't think you're being a hero and go to work when you're sick, because you're actually doing more harm than good. You're again passing whatever you have, whether it's COVID or the flu or a cold, along to someone else.
Yes, I agree with you.
Let's take a look at the outline so folks at home will know what to expect, and I'll know what to expect. We will talk about what is the flu. We will then discuss symptoms, how the flu spreads, what's new this flu season, and prevention, that all-important prevention.
Yes.
If we can stop it from reaching us in the first place.
Yes.
So, what is the flu? I know this might sound repetitive, and people would say, I know what the flu is. But for those that maybe aren't totally sure,
Yes.
let's go over the definition.
Yeah, so the influenza, so that is what flu is short for, is a contagious respiratory illness that is caused by the influenza virus, and this affects the person's nose, throat, and lungs. And this virus can cause mild to severe illness in individuals. We see thousands of hospitalizations and even deaths. So it's very important to protect yourself against the flu. And I also like to mention that although there is more types, more strains, the two main strains that cause the flu epidemic every year is strains A and B.
Very good. Next, we will address symptoms. And again, as you had mentioned at the beginning, a lot of these symptoms kind of transcend diseases, transcend illnesses.
Yes. So just like with COVID, people who get diagnosed with the flu, they may feel themselves becoming feverish or chills. They may have a cough, sore throat, runny nose, or stuffy nose. Those are kind of opposites there. Muscle and body aches, headaches, fatigue, and then nausea and vomiting, and also diarrhea. But those GI symptoms, we see them more likely with children than in adults. And it's important to know that you're not always going to get every single one of these symptoms. Not every person with the flu gets a fever. So you just want to make sure you're monitoring. You want to take care of yourself, because if you're one of those people who does try to push through your illness, if you're not treating yourself properly, it can lead to pneumonia, and you can get really sick from it. So you want to make sure you're taking care of yourself if you do start to develop these symptoms.
So if you're compromised, or anyone is compromised, pay, I suppose, particular attention to that.
Yes, and they say I normally have the section in here. I didn't this episode. I know that, again, we do this every year, but those who are at higher risk include people who are 65 and older, people with immunocompromised conditions, and women who are pregnant as well. So they want to make sure that they're really keeping themselves safe, staying away from people who are sick, and just monitoring themselves throughout this flu season.
Perfect, because we will talk now about how the flu spreads.
Yes, so the main route of transmission is through droplets. Again, this is very similar with COVID as well. So these teeny droplets are in an infected person's saliva. So when they talk, when they sneeze, if they're laughing, singing, these teeny droplets are spreading through the air. And they also, the CDC says that this can also be up to 6 feet, the same with COVID. Less often, people could get sick from having contact with, say, I had the flu and I'm coughing on this table and somebody else put their hand and then touched their face. They're likely to, well, I wouldn't say likely, but they could develop flu from that.
And you say touch your face, if you touch your eyes, your nose, your mouth?
Yes, so all of those reservoirs where the virus can enter your body, if your skin's intact, you should be okay. If you have no wounds on your hands, that's all right. You want to make sure that, we'll get into that, but you want to make sure you're washing your hands and you're not touching your face while you're out and about, because you never know what viruses are on your hands.
What about the time that the flu is contagious? What's the period?
So a person is considered infectious the day before their symptoms begin.
Which is tough, because you don't even know you have it at that point.
Yes, so the day before it begins and then 5 to 7 days following their symptom onset. It's important to know that for infants and for those who are immunocompromised, their infectious period could be longer. So you just want to make sure, if you have an infant who's battling the flu or you're immunocompromised, you want to make sure you're checking in with your doctor and you're keeping those around you safe as well. You don't want to go around them while you're still exhibiting symptoms.
So for the average person who gets the flu, what's the time frame? How long could they be sick with the flu?
So they say, it depends on the person, and normally it's like up to 7 days, but basically you want to make sure you're just getting rest, you're hydrating, you're consulting with your doctor to see, God forbid, if it developed into pneumonia, that you're getting the right treatment. So it's time sensitive depending on the individual.
Now, new this season, there are always new variants. There are new strains.
Yeah.
New strains, not new variants, but new strains.
Yeah, so with the flu, and according to the CDC, it's very hard to predict what the upcoming flu season is going to be. These past couple years, we've been battling COVID at the same time.
Which has been tough.
And there were a lot of measures in place previously with COVID, like people were wearing masks, kids weren't in schools, people were working from home. So we were kind of protected both with COVID and the flu. We weren't seeing as many cases.
And now we should also mention that folks aren't wearing masks as much.
Yes, yes. And if we could pull up on the screen, there are 4 new strains that are being looked at this season, and that is there are 2 different types of vaccines. The first one is an egg-based. In the composition, I have the 4 listed there up on the screen, and then there's also the cell-based vaccines as well. Pretty similar strains between both of those vaccines. I'd kind of like to put those up there because these strains are very long rather than myself just talking about them.
Absolutely. We'll get into the names in just a moment. Just really looking at the names, some folks might question origin.
Yes, so I know you always love to look into the origin of each strain and why they're named. So I did a little research, and the CDC follows it's an internationally accepted naming convention for influenza. So there are different things that they look at when they name a new strain. It's the antigenic type, so is that A, B, C, or D? The host of origin, for example, is it swine, is it chicken, things like that. They also look at the geographical origin, where that came about. There's also strain numbers and year of collection. So that's why each year it's kind of a lot to see these different strain names.
That's why it's so long.
It's a lot of information, but there's a lot of different things that the CDC and internationally, when they look at these strains, they kind of pinpoint it based on those different genres.
And is the vaccine developed as a result of where else in the world it's popped up before it comes here?
So yes, each year as like the Southern Hemisphere kind of sees, because there's flu season's kind of ending while ours is beginning.
Right.
So it's off research of what strains they're seeing around the world and around here, like what we've seen last year. So there's a lot that goes into what makes up the current doses for this year.
Let's look at for the 2022-23 flu season. The CDC is recommending individuals 65 years and older to receive the following.
Yeah, so these doses, so there's the Fluzone, which is a high quadrivalent flu vaccine. That basically just means that it's covering 4 different strains. So we have the Fluad, Fluzone, I'm probably going to mispronounce this one. Flublok is another one. Basically, what these different vaccines are, they're higher doses. In the higher dose of antigen in the vaccine is intended for those 65 and older to get a better immune response to the vaccination, therefore better protection. Because as you age, your immune response isn't as active. So that's why it is recommended for anyone 65 and older to get those higher doses. Yeah.
And for everyone else?
And for everybody else, the CDC is recommending, so it's anybody 6 months and older. They are recommended to get their flu vaccine. This is every year they should get it. A lot of times, I know we're in October right now, so if you haven't received your vaccine at this point, it is still recommended. The CDC recommends getting this vaccine in September or October. But again, if you didn't get it yet, it's still very important to go out and get that vaccine because that would provide you with protection through March, which is where we'll still be seeing cases. We haven't seen the peak of flu season yet.
Right. So you say March, still obviously the flu is at play. When does it simply disperse?
So basically the flu season here is kind of October to March.
Okay.
So yeah, so after that you'll kind of slowly see it dwindling down, hopefully. Of course that may vary year to year, but that is generally where we see it. That's kind of our everybody's back indoors, everybody's around each other. Fall is a big time where these viruses can survive and pass to one another.
Right. We'll get to prevention in just a moment. One of the top, at the top, I guess, points would be that crowds, anytime you're in a crowd during flu season, that's obviously the likelihood of getting the flu has increased.
Yes.
But we'll again look at that in just a moment. I do want to talk about, for those folks who have been getting the COVID vaccine and the boosters,
Yes.
the importance to also get the flu vaccine because they won't protect against one another.
Yes, that is a good point to make. So each vaccine, the COVID vaccine, is only doing COVID variants and COVID strains. The influenza vaccine is just for the influenza strains. So it's very important to get both vaccines, especially going into this season. We want to make sure that you're protected both against COVID and influenza. It's also important to know that it's safe to get those vaccines at the same time. If it's only easy for you to get to one appointment, you can see if you can get COVID and your influenza at the same time. I know working in the health department, some people don't like that. They kind of want to be able to tell if they were to have a reaction, they want to know which one made them sick, which is perfectly fine. So it's all what people are comfortable with. But according to the CDC and MDPH, the state health department, it's safe to get them at the same time, and you could even get them in the same arm if necessary.
Perfect. I guess my concern, and maybe folks share this as well, is the fact that folks needed the COVID vaccine, and then they needed a series of boosters, and now folks need the flu vaccine. You just hope that that they don't grow weary of getting vaccines.
Yes, and that it's been very tough lately, especially as we're on, I don't want to say the back end of COVID, because COVID's here, obviously, and
the numbers are ticking up slightly.
yes, that's expected. Again, people are indoors, people aren't masking, all the protocols are slowing down. You're no longer quarantining if you're exposed, things like that. But the biggest thing, you just want to protect yourself. Make sure you're getting your vaccinations. If you don't know when is the proper time for you to get it, or say you got your COVID vaccines, you don't know when you can get your booster or the flu, you can call your healthcare provider, and you can also reach out to your local board of health, and we're always happy to discuss and kind of give some advice on when would be the best time.
So what you're saying too is that if folks get a vaccine in October, that will carry them through March.
Yes. So there is some concern because I know some pharmacies start rolling these vaccines out in August.
Right.
So when you get it really early, there might be some concern that the protection won't last through the full season. But if now, September and October is when they tell you to get the vaccine. So if you are getting vaccinated right now, you should have that protection.
Okay, very good. Let's talk about prevention. I hinted when I spoke about large gatherings.
Yes. So, of course, I know we just discussed this. Our biggest thing at prevention is always vaccination. So you, again, make sure you're going out, getting vaccinated. And you also want to, if you are sick, you want to make sure you're staying home and not going out around others or large crowds. I always, right now, as a public health nurse, if somebody were to call me and be like, I woke up with a stuffy nose and a fever, I would recommend them take a COVID test if they have that available. So if you're COVID negative and you're just not sure what's going on, definitely consult with your healthcare provider, especially if you're getting sicker. But if there's something you have to do and you're not feeling good, make sure you put a mask on to do that task, because you don't want to be breathing on others and spreading the virus.
And just you saying that, I didn't mean to stop you, but I felt like if I didn't, then I'd forget this totally and completely. It's, of course, you want to protect others, but if you're out when you shouldn't be, you're not helping yourself either, because the body repairs itself when it's at rest.
Very true. Yeah. So you want to make sure if you are sick, you're home. I know, it's tough because people can't always be home. People have responsibilities, they have jobs and everything like that. So do the best you can. Definitely, if you are sick, wear your mask. Or even if you are immunocompromised and you have to run to the grocery store, it might be safe to put a mask on for your own protection. Other things, avoid close contact with others who are sick. Cover your mouth and nose when you're out or if you're sneezing. Another good thing that especially you like to teach like young kids is if you're sneezing or coughing into your sleeve, that way you're not coughing into your hands and then touching everything. That is how viruses can spread, and that's often why we see such young kids, it's spreading so easily in daycares and things like that. Wash your hands, and I know I said this earlier, but make sure you're not touching your face, your eyes, your mouth with hands that are unwashed. And then also practice good health habits. So make sure you're staying hydrated, you're getting enough rest. You just want to make sure you're taking care of yourself, eating good fruits and vegetables, getting your nutrition. So.
Right, because if your body is protected, if your immune system is operating at full capacity, let's say, then the chances of you getting it are less.
Yes, and you
that
want,
and anything else for that matter.
Yeah, you want, if you're treating your body right, your body will better have the chance to fight off any illnesses.
And that's, I know we're talking about good health habits, eating, but exercise as well.
Yes, exercise is very important. I know we've talked about this on many shows, but even, and I know that's not always easy for somebody to do, but even if every hour you get up and do a 5-minute walk around the house, things like that, just to get up, get moving. Any slight difference in your daily activity, any increase is going to benefit. So just slow increments and.
Yeah, we're not talking about running on a treadmill specifically. We're not, although that's fine. We're not talking about running. We're talking about getting up and walking.
Yes, yes. And I know working for the City of Quincy, I know our Kennedy Center, our senior center, they do have programs. They have like strength classes, yoga classes. They even have a walking group. I believe that probably operates more in the summer months where it's warmer to go outside. But definitely check in with loved ones, go for a walk with a loved one, or check out your local community resources and see what's around you to get out there and stay active, but also stay safe and make sure you're following all these measures to keep yourself safe against flu.
Absolutely. You highlighted the City of Quincy, which you would because you work for the City of Quincy, but any other municipality has similar centers where folks can maintain a healthy lifestyle.
Yeah, so yes, a lot of different communities will have those senior centers, and I do know that a lot of senior centers, it's not just based for that city. So even the City of Quincy, you don't have to be a Quincy resident to come there. So hopefully that's the same in other communities as well. But definitely, as I say, if you're looking for further information or where to go get your flu vaccine, you can reach out to your local Board of Health, or on the CDC website, there is a flu vaccine finder, and you would basically put in your zip code, and they bring all the closest pharmacies where it's available around you.
And we should mention that a lot of the major pharmacies, actually probably all of the major pharmacies, do have the vaccine, and there's no shortage this year, is there?
No, at this point, I do not believe there is any shortages. One thing that I've been just getting calls to my department, you just want to make sure you're making appointments for these events, because I do know I've had a couple people tell me they've showed up and then they're turned away because these different pharmacies are very busy right now because they're vaccinating others, they're doing their other jobs as well. So you just want to make sure you're reaching out to your community, seeing the closest place, and your local Board of Health, again, will always help. We like to help people schedule if we can't assist them ourselves.
Very good. I know when you said the pharmacies are involved in other things, of course, COVID and the boosters, because
Yes.
that's continuing. You did mention about washing your hands, and I just kind of want to end on this because often people don't do it the right way.
Yes. So definitely one good thing you can do is 2 rounds of happy birthday as you're washing your hands. It might get stuck in your head all day. But even a couple times just to kind of see how long you should actually be scrubbing your hands with that soap and water. You want to make sure you're getting under your nails as well, especially if you have like acrylic nails on. My nails are pretty long right now, so I make sure when I wash my hands I'm scrubbing underneath, because you don't know what bacteria can be underneath there.
And do your whole hand back
The
and
whole
front.
hand, in between your fingers and all of that. And it's just a good way, especially as you're teaching your young children to take care of themselves and wash their hands. It's kind of a fun way to walk them through it. So 2 happy birthdays.
2 happy birthdays. And if you're in a place that doesn't have water or soap, the sanitizers are good for that moment.
Yes, definitely, as you said, if no soap or water is around, definitely hand sanitize. They are very good to use. The best form is always soap and water, though.
So the hand sanitizers basically make it so that the germs have a hard time adhering to your skin, right?
Yes.
Is that what the basic premise is?
I believe so, yes. And also kills like some of the bacteria on contact as
Right,
well.
Right. Well, very good. I think this was a successful show. Thanks to you. Thank you very much.
Yes,
A lot of
thank you.
information. Yeah. And for the city of Quincy, but also beyond the city limits, this is something that affects the whole country. So certainly everyone can benefit from this show.
Yes, and I always, especially where our show now expands just beyond the city of Quincy, I do always like to say I get all of my facts from the CDC and from the state health department. So they are very universal facts that I review here. But again, any resources, if people have questions, they can go to both of those websites to find further information.
Very good. Well, we'll have to have you back on a different day with a different topic.
Yes.
Thank you for today.
Thank you very much.
And thank you at home for watching. Please continue to support your local access center in the community in which you reside for programming just like this.